Hi, and welcome back to Ivor is on chemo. Ivor on chemotherapy. But we've done that. Okay, so as promised, this video will be telling you about my first 2 weeks on Capecitabine, or is that Capecitabine, also known as Xeloda, and what I experienced. One thing to note is that talking to others that have been on this medication is that not everybody gets all of the side effects. Some they do, some they don't, and it's not the same for sure. Certainly, two of the main people I've been speaking to have had different side effects, or more of a different side effect than I have. There we go. So this is what I had to deal with in my first 2 weeks of my first cycle, and how it changed how I live and my life in general. Give you a hint. Not much. Here we go. First, let me state, what are the normal side effects and can be expected? Again, remembering they will not happen to everybody. Okay, so let's start off with the messy one. We'll start off with diarrhea. But then, as I got colorectal cancer and I've just had surgery to remove most of my colon, let's be honest, I suffer anyway, but it could become worse. The one that they always worry about, which is the sickness, nausea, and actually vomiting. Then you can get a sore mouth and a sore throat, hand-foot syndrome, stomach pain, loss of appetite, feeling tired, hair loss. We've been through this levity bit. The hair loss wouldn't bother me in the slightest, but there we go. But it can also have, in rarer cases, effects on the eyes, headaches, feeling dizzy, sort of the thing you might get with a bit of vertigo. But that's a rare thing to get. Okay, so let me tell you about the ones that I've had, and frankly, it's not many. So my oncologist was more concerned about hand-foot syndrome. And I've had soreness on parts of the soles of my feet. On the left foot, it was in one place. In the right foot, it was another place. But probably means I'm not walking properly. But okay. But normally that would come if I walked a lot. Things that helped were suggested by the doctor, and I did. So that's moisturising feet and hands. Now, the doctor gave me medicated lotion. I used CeraVe because I've always found it to be very helpful. There we go. Wearing socks and soft shoes. This is Thailand. It's rather hot. Most of the time I don't wear socks or shoes, but I have been during this first cycle. And if what I've experienced is anything to go by, they certainly do help. I use Crocs as my shoes to wear around the place, and that certainly seemed to help. But also at times, if my feet got sore, quite sore that is, I'd get off my feet for an hour or two. And I'm not talking about sitting, I'm talking about laying down, raising your feet up, that sort of thing. This was my worst side effect completely. Towards the end of the cycle, though, I had little to no soreness at all. it was mainly sort of in the first week and a half. So towards the end, red, a little bit of skin coming off, but nothing terrible. As for my hands, a little bit of tingling and soreness in my fingertips, especially when dealing with like ice or handling hot items like cups of hot drink. They would sting, but not for long and not much really. Nausea. Now, this is one that doctors always worry about. I think 3 or 4 times I had nausea, and it would normally go within sort of 15 to 30 minutes. Never took a med for it at all. Thank goodness. Feel I was lucky on that one. As for headaches, yes, I've had headaches nearly every day behind my eyes, sometimes causing dizzy feelings, a little bit of blurred vision at times, not much. But it really is just like a normal mild headache, and nothing that concerned me in the slightest. A couple of paracetamols, job's a good one. Diarrhea. Okay, yeah, on a couple of times I've had it worse than normal over the 14 days, and I did take 4 tablets in total over the 14 days in which to fix it. Really, to be honest with you, it wasn't the side effect, it was something I was eating that I do enjoy, but my stomach doesn't. And no, it wasn't spicy food. I was warned off of spicy food, so I don't do it anymore. No. Right, stomach pain. Yeah, a couple of times. But those were a couple of times when I didn't have diarrhea. Go to the toilet, not a problem. Over and done with. Now, today, when actually filming this, I've just had my first follow-up blood test and consult with the oncologist. Yeah, at times I have struggled with saying oncologist. No, not on the alcohol either. I've been TT for nearly 30 years, or mostly. Anyway, according to her, everything's currently fine and dandy. But I have to have another test in a week to see if I'm ready to start the next cycle. This is probably due to the fact that it's during the medicine off week that the white blood cell count does tend to drop off. And she'll probably want to see how good, bad, or indifferent that is before putting me back onto chemo again. I mentioned to the doctor about me having a seemingly small amount of side effects, and the side effects that I had were not terrible in any way, shape, or form, or at least that's how it felt to me. But she has said that during the second and third cycle, it can become more. Now, as I've said before, I've been talking to other people, and none of them have had that happen. But I'm ready if it does. So, in general, I had a pretty good 2 weeks on the chemo, apart from one day. I've managed to do most things I would normally. That is, as I do as a stay-at-home dad. Thank goodness they're teenagers now and they do chip in. Mostly to take my mind off of cancer and chemotherapy, which is pretty good. Now, because I have to have another blood test next week, and the only time it can be done is what should be on the first day of my second cycle. That second cycle is going to be delayed by 24 hours. which is a bit of a meh, but it is what it is. She wants to see these blood test results before she'll even give me the next set of chemo meds. If this is the only time it delays, then I should complete, touch wood, on the 3rd of April 2026. Looking forward to that. Gotta say, to be totally honest, that I feel I've been very lucky. And if this is what I face, and a lot of people say what you get in the first 2 cycles, apart from fatigue, which tends to get worse, if the other things you get in the first 2 cycles, that's what you normally expect to get through all of the cycles. We'll see, so will you, because I shall be doing the videos. So frankly, I feel I've been pretty lucky. Okay, so the next week, the next video will be next week, after a week of no meds, but I will hang on to include what the next oncology visit is as well. Anyway, hopefully this has been of help and informative. Look after yourself. Sending you all strength.